Emeritus Professor Dr. P.T. Thomas, Executive Dean, Faculty of Health and Medical Sciences, to give his opening address for this event.
Thank you, Savish. Good morning, Associate Professor Dr. Ganesh Ramachandran, Nicole Gunn, the chairperson for the project, leadership of the School of Medicine and TUMS, staff and students, respected Cikgu Dr. Bernard, ladies and gentlemen. First, let me express my gratitude to Taylor's University School of Medicine and the Taylor's University Medical Society for inviting me to this closing ceremony of Sarawak Food Aid COVID-19 Fundraiser. In these times of economic uncertainty, it is commendable that the students raised a total of 7,910 in less than 2 weeks. All funds raised for this fundraiser would be transferred to Greatmind Bintulu, a community-based organization in charge of the well-being of the people of Kamina, Sarawak. Although the COVID-19 pandemic has placed severe restrictions on movement, but the work of helping the poor and needy has not been restricted. We have seen a significant number of movements, often initiated by young people and students, including our medical students, to help the less fortunate. A few months ago, the medical students of Taylor's University raised funds for the National Cancer Society, and some volunteered to help in the vaccination of cancer patients. The staff of the School of Medicine have at least twice had fundraising efforts to help the hospital Sungai Buloh. Taylor's University has also started the Ducky Pie initiative, where computers similar to Chromebooks are assembled by Taylor students and staff and supplied to the B40 community free of charge. This is to help the children to be able to follow the online classes. I would also like to applaud the work of Dr. Bernard, a retired school headmaster, who in his retirement years is active in helping the poor and needy. What a way to spend retirement. I'm sure the funds collected by the students and staff will be used by you and Greatmind Bintulu to help many. God bless you, sir.
Thank you.
Students and staff of SOM, you may have heard me say before that I have heard positive reports about our medical students and graduates. These reports generally say our students are different when you go to the hospitals. They are serious about their training and work even as students, as housemen and medical officers. This effort of yours demonstrates another dimension of the characteristic of Taylor's medical students. Students, when you graduate and start work, please bear in mind that you will be in a privileged position. And I hope that you will continue to have a heart for the less fortunate, the poor and the needy. So let me once again congratulate and thank the staff and students of the School of Medicine, Taylor's University, for raising funds for Sarawak Food Aid, and applaud Dr. Bernard for his work among the poor. Please keep up the good work. Thank you very much.
Thank you, Professor Dr. Thomas, for your welcoming speech. Now I'll pass the floor to Nicole Gunn, Taylor's University Medical Society's project chair, for the introduction on this fundraising project.
Thank you, Savish. Good morning, Prof. Thomas, Prof. Ganesh, Dr. Bernard, lecturers, and my fellow colleagues. I'm Nicole, the project chairperson for our Sarawak Food Aid COVID-19 fundraiser. I would like to begin by sharing a little about the 3 longhouses that we are supporting in this fundraiser. They are Rumah Patrick Admin, Rumah Yus, and Rumah Philip. They are all located in Sebauh district in Bintulu, Sarawak, and these longhouses, they are situated about 4 hours drive away from the nearest town. Krishna, next slide. Yeah, there are no roads, and the only way to reach these houses are by using a 4-wheel drive on a muddy field plantation road. And with this recent pandemic, many of them in the longhouses have lost their jobs, making it very difficult for them to purchase their daily essentials to support their family. So because of this, they have reached out to Taylor's University Medical Society as well as Taylor's University School of Medicine for help. And after much planning and discussion, we officially launched the fundraiser on the 30th of August through social media as well as WhatsApp. And as this was my first time leading a fundraiser project, I was definitely very nervous that we wouldn't be able to hit our target of 5,000 ringgit by 2 weeks. But to my surprise, in just 5 days, we managed to hit our target. And in 2 weeks, we raised a total of 7,910 ringgit. We received donations from a variety of donors, such as students, lecturers, the public, a church, as well as a small NGO. So with that, I would like to thank everyone, especially Dr. Priya and my committee, for all your hard work and time put into making this fundraiser a success. Throughout this project, I've encountered so many people who were very willing to lend a helping hand to those in need. And this really gave me a sense of achievement. And I truly look forward to organizing much more projects like this. Thank you very much.
Thank you, Nicole. Now, it is time for the main highlight of our event this morning. That will be the mock check presentation by Taylor's University Medical Society to Dr. Bernard Tahim, Chairman of Greatmind Bintulu, a community of the well-being of the people of Kemenah, Sarawak. Let us now welcome Dr. Bernard to give his speech.
All right, thank you. Hear me? Good morning. Can you hear me?
Yes,
Yes.
Doctor.
Yes.
Morning.
Okay, thank you very much. Thank you. Ya, yang berbahagia, Emeritus Professor Dr. P.T. Thomas, Executive Dean, Faculty of Health and Medical Science, Tyler Universities, Assistant Professor Ganesh Ramachandran, Head of School Medicine, Tyler University, Dr. Priya Mahadevan, Senior Lecturer, School of Medicine, Tyler Universities, Project Chair, Nicole Gans, and all presents. I wish you all a very good morning. So I'm Dr. Bernard. I'm the chairman of Greatmind, Sebauh Bintulu actually. I'm very glad and thankful that Tyler University, especially the staff and students from the School of Medicine, have been very supportive toward reducing the sufferings of the people in Kemenah, my hometown. Our relationship with Tyler University started in 2018, when I had the unique opportunity to visit your campus in Sunway. I met up with Professor Dr. Rosli and Dr. Priya, who have strongly supported the program that we had in Kemenah. After a very successful health screening clinic that was carried out in 2019, we have the opportunity to work together again. I hope that Tyler University will continuously support us here in Kemenah, Bintulu Division in Sarawak. The COVID-19 pandemic has been a very difficult period for the people here. The community is bereft of basic infrastructure and utilities. What more to say, the daily supplies, especially in the far-flung longhouses, some of which take 6 hours to reach by longboat. Unlike the people living in Peninsular Malaysia, the rural folks here can't even raise the white flag to ask for help. Greatmind Bintulu has seen last year April successfully secured assistance from well-wishers to assist these people in whatever way we can. By the good Lord's grace, Tyler University has once again stepped forward to give a helping hand. Thank you very much to Thailand universities. I wish to sincerely record my heartfelt appreciation to all of you, especially the young medical students who have gone out to their way to assist us here. I wish to congratulate Thailand University for being a responsible and empathetic corporate company. The financial aid that your project has collected will be used to assist around 150 to 160 families living in 3 longhouses mentioned by Nicole just now. My team and I will ensure that every cent that you have collected will go towards assisting these families. I also would like to take this opportunity to invite all of you, medical science consultants, specialists, and students to come and visit us here. This will give all of you a clear picture of the life here. And I hope that Thailand University will work together with us to effect a change in the medical and lifestyle well-being of the people here. The health screening program that you had conducted in 2019 is still pending due to the pandemic. I hope that you can continue that effort once the travel restrictions are lifted. Yeah, it will also be a good exposure to the young doctors to witness and experience the life in the interior of Sarawak. So we look forward to working closely with you in the coming days, and I thank all of you for your indulgence and kindness. Thanks God, and God bless.
Thank you, Dr. Bernard.
Yes.
We will now officially hand over the mock check to Dr. Bernard, and we'll be taking a photo at the same time, everyone. So please do smile.
Yes, thank you. Yeah. Yes.
Okay, 3, 2, 1.
Thank you very much. Thank you for the young doctor. Yeah.
Alan, has the photo been taken?
Yep, photos taken.
Okay, thank you. Last but not least, I now invite Associate Professor Ganesh Ramachandran, the head of School of Medicine, Taylor's University, to give his closing remarks.
Thank you. Good morning, everybody. I would like to first of all welcome Dr. Bernard Tahim to this function. Emeritus Professor Dr. P.T. Thomas, Dr. Lim Su Yin, Associate Prof. Karatan Chinna, Dr. Priya Madhavan, Mr. Ravi Nair, and the medical students of the Taylor's University Medical Society. Thank you for inviting me to close this session. And I just want to begin by quoting the Dalai Lama, who said, "Love and compassion are necessities, not luxuries. Without them, humanity cannot survive." And I think it's a very apt quote to reflect the work that has been done by the Medical Society in extending aid to the people of Kemana, Sarawak through the Sarawak Food Aid Program. It is small measures like this that actually make a difference in what makes you finally a good human being and a good doctor. And I am very proud that in my 3 months here, I have seen the students take part in many such activities which emphasize the need for us to care for fellow human beings, to exhibit compassion and empathy in what we do, as well as to hone your skills in entrepreneurship and managing projects like this. I would like to just say congratulations. Keep this work up, and we will continue to engage with Dr. Bernard to see how we can work with Great Minds, Bintulu, because I think there are a lot of mutually beneficial projects that we can undertake together, which will expose students to some of the inequities that we have in this country in terms of healthcare delivery. Because being in Klang Valley and in the west coast of West Malaysia, we sometimes don't see what is happening beyond our very, very small area. I grew up in Penang, and before I went to Kubang Kerian as a medical student, I had never thought that we had beriberi and kwashiorkor in this country. But when I went to Kubang Kerian in the 80s, I saw malnutrition for the first time. I saw beriberi for the first time. I saw people dying of cholera for the first time. And that's when I realized that it's not an even playing field, even in a country like Malaysia. And I think that is what we from the Semenanjung need to understand. And I hope we will be able to work with you, Dr. Bernard, because I think it will be a worthy project for our students to undertake. And if we can help you in some way during that project, then that's just an added bonus for us. Thank you very much. Thank you.
Thank you too. Yeah.
Thank you, Prof. Now let's have a group photo taken. So say cheese, everyone.
Krishna, could you unshare the slides? Yeah. Krishna. Am I audible, Sarvesh?
Yeah, you're
Yes,
audible.
yes.
I think,
he has, he has some connection problem.
Yeah.
I see, okay, because I'm able to get the view. Okay, I think this should be fine. Right. 3, 2, 1, smile. Okay, one more, yeah. 3, 2, 1, smile. All right. Thank you, everyone.
Thank you.
We have now come to the end of the closing ceremony. Thank you everyone for your time and effort to be present this morning. Please take care and stay safe.
Yeah.
Thank you very much. Thank you, Dr.
Well done,
Bernard.
everyone.
Yeah, thank you. See you.
Well done.
Thank you
Thank
everyone for
Bye.
joining.
Thank you. Bye.
Bye-bye.
Take care.
Bye-bye.
Bye.
Thanks.
Thank you. Bye-bye.